My paper is on optical coherence tomography angiography as a prognostic tool in anisometropic amblyopia. We have no financial disclosures. Amblyopia or lazy eye is one of the most common causes of reduced vision in children as well as adults. It's a condition of unilateral or bilateral decrease of visual functions caused by form deprivation and or abnormal binocular interactions that can be explained by a disorder of ocular media or visual pathway itself. Anisometropic amblyopia refers to unilateral amblyopia caused by a distinct refractive error of each eye. Optical coherence tomography has been vastly studied in amblyopia in terms of thickness of macula, fovea, and retinal nerve fiber layer, but there is no consistent in the results. As we know, gold standard of amblyopia treatment is patching. Though macular thickness and foveal thickness was found to be more in anisometropic amblyopes and found to have shown a decline in the thickness following occlusion therapy, but there is no consistency in the results in the RNFL thickness. So why OCTA? It's a novel non-invasive imaging tool which does not use the injection of dye and assesses the vascular flow in a short period of time. It stratifies the retina into 4 layers. It quantifies the foveal avascular zone and vessel density. Keeping this in mind, our aim was to analyze the vascular pattern at the macula in anisometropic amblyopia and to find out the association of vascular changes at the macula with improvement in vision following treatment, that is patching. So we framed our research question: can OCTA parameters be taken as a prognostic tool for improvement in vision in anisometropic amblyopia? This is a cross-sectional study design done in 37 eyes of children less than 18 years of age from 2011 to 16 at Narayan Nethralaya, Bangalore. We have excluded children with a previous history of spectacle wear or patching, more than 6 diopter sphere and more than 3 diopter cylinder, constant squint nystagmus keratoconus, history of eye surgery, corneal scar, neurological and developmental issues, poor compliance for OCTA imaging, non-compliance with the glasses and patching, and poor quality images. We took a detailed history, vision examination according to age-appropriate charts, orthoptic evaluation, anterior posterior segment evaluation, and cycloplegic refraction. OCTA ratio analysis algorithm is a novel algorithm which is attached to the OCT machine, Sweptosource OCT machine, which detects the blood flow, even low blood flow, with a good level of accuracy. So this machine divides the retina into 4 layers: superficial capillary plexus, deep capillary plexus, outer retina, and choriocapillaris. This process is known as segmentation. The superficial capillary plexus is a centripetal arrangement of vascular plexus around the foveal avascular zone. It starts from 3 microns from the internal limiting membrane to 15 microns from the internal plexiform layer. The DCP is a closed network of vascular plexus which starts from 15 microns from the internal plexiform layer to 70 microns from the internal plexiform layer. The outer retina doesn't have much of vascular plexus. It starts from 30 microns from the internal 17 microns from the internal plexiform layer to 30 microns from the retinal pigment epithelium. And the outer retina, the choriocapillary, it has a patchy network of vessels, and it starts from 30 microns from RPE to 60 microns from RPE. So coming to our results, the parameters which showed significant difference between the improved and unimproved eyes were sectoral and large vessel spacing in the deep layer and the total vessel density in the deep layer. These are the vessel parameters in the hypermetropic, meridional, and myopic anisometropic amblyos, but they didn't show any significant association between these three groups. These are the OCTA images. Here, the warmer color indicates increased vessel density, and the cooler colors indicate decreased vessel density. So you can see only in the deep layer improved cases, there is the red is more, indicates increased vessel density in that layer. Whereas all the other 3 images, the cooler color is more. This is the total vessel density in the improved and unimproved stage, showing a significant association. These are the total vessel spacing and the sectoral vessel, large vessel spacing in the improved and non-improved eyes, showing a statistically significant association. So it's known that OCT parameters was previously analyzed in anisometropic amblyos, but the results are not consistent. And only one study analyzed OCTA following occlusion therapy in amblyos, which showed a significant difference in the vessel density in superficial capillary plexus, but not in the DCP. But our study, it shows reduced vessel density in the deep capillary plexus as in previous studies. The vessel density and vessel spacing in the DCP in amblyopic eyes showed a statistically significant difference in children who improved following occlusion therapy. So, OCTA parameters could be taken as a prognostic factor in anisometropic amblyopia. But in future, longitudinal studies with larger sample size to look for the correlation between OCTA parameters with amblyopia treatment would be required. Thank you.
Do we have any questions for the presenter, please?
I have just one thing to say to Dr. Remya.
Yes, ma'am.
This is an interesting study, but tell me how useful would it be in day-to-day practice for strabismologists or those who are treating amblyopia?
Yeah, that's what, ma'am. So if we do OCTA, this is a non-invasive technique. So if we do OCTA and if we are seeing an associate, means the deep vessel capillary plexus is more, we can tell the parents that this child is has more chance of getting amblyopia improved compared to the children with a low vessel density.
But that you could tell even by vision improvement,
So that it can be taken as a
simple vision improvement. If a child
no, ma'am. If a child with
with amblyopia is improving, say after 1 month of patching, it indicates that the prognosis is good. The chances of his improvement are good. This is so simple. Why do we need a sophisticated tool for this? It's okay as a research question,
but
as a research modality, fine. But how useful is it going to be in day-to-day practice?
Yeah, but all children with reduced visual acuity may not improve even following amblyopia treatment. So if we could see an association with these parameters is showing more improvement, we can tell them that this child is more chance of getting improved.
Okay, anyway, fine.
I think I'll rephrase your point, doctor. I think both children will improve with occlusion therapy. Probably your subgroup will improve a line better, a line more.
Yeah, that's true.
Not like
yes,
the
sir.
other group will not improve. So in that way, what madam says is very relevant. Why you bring a huge investigation into the arm and doing OCTA in children is not going to be easy, especially in amblyopic children. OCTA especially prefers perfect fixation and perfect centering of the OCT for a sequential cuts. And that might not be able to do in a amblyopic child. So all these are parameters. Anyway, interesting. Thank you.
The cost also will go up. Cost of